Hi, Dr. Tony Harrison here with Incredible Health. I wanted to go over hormone pellets today and why they've become so popular. The number one benefit that hormone pellets offer to people is convenience. You come in once every 3 months, it's a quick 10 to 15 minute procedure, and then you're back out on the road again. And so you don't have to interrupt your daily routine every day to take pills or lotions. It just makes life so easy and convenient. And considering how crazy busy our lives have become, anything that can simplify your life routine has benefit to people. And so it's just quick, easy, convenient, and it makes people feel so much better in their day-to-day living. The other benefit that I appreciate probably more than my patients do is the lack of transference. So when you're doing a lotion, it's possible to transfer that hormone to other people or your pets. And you certainly wouldn't want hormone being transferred to your children, your grandchildren. Typically, intimate activities occur at nighttime, so people will put their lotion on in the day, in the morning. But it takes hours to soak in, even if you're using gloves. So you need to be aware of that, so you're not putting it on body parts that you hug. People throughout your day and might transfer some hormones. So for those two reasons, pellets have become popular: convenience and lack of ability to transfer the hormone. We use testosterone pellets for both men and women. There's of course a big difference in the dose. Women, what people don't realize is testosterone is just one step away from estradiol, which is your main hormone. And so people will convert from testosterone to the estrogen that the body needs in the fat tissue, in the adipose. Most women have enough fat for that conversion to take place. Your super scrawny women that don't have any body fat on them are typically the women that would require an estradiol pellet in addition to the testosterone pellet. We follow the hormone profile, and so if we see that a woman is not making enough estradiol from the testosterone pellet, then we can go ahead and add the estradiol pellet down the road as we're fine-tuning the hormone prescription. But typically most women do just fine with a testosterone-only pellet. For our male clients, we use a testosterone and an anastrozole pellet. The anastrozole prevents the testosterone from being converted to the estradiol. Men need some estrogen, but not a lot. So you want to prevent a lot of that conversion. And again, that's something that we follow on the hormone profile to make sure that a man is not creating too much estradiol. Side effects: sometimes the skin can get oily, might get a little bit of acne, some scraggly facial hair. Women are not going to be able to grow a full beard, but they may get a few little scraggly hairs that they can either pluck or laser, or some women will just grab their husband's razor and just quickly be done with it. Middle-aged women are known to get some scraggly facial hairs anyhow, so that typically is not much of a problem. It doesn't seem to bother women too much. The other side effect is the clitoris can become a little bit enlarged. Again, this is a side effect that women tend not to complain about because it means that the clitoris is more prominent and sensitive, so it's easier to reach orgasm. So I have not had a woman come back and complain about that side effect yet. Also, you can get a little bit of voice deepening. It's not enough to mistake a woman for a man, but typically some women might notice that their voice has deepened a little bit. But the potential side effects really are minimal, especially if you stay within physiologic ranges. The goal is to take people's hormones back to the 25 to 30-year-old range. When people were 25 to 30 years old is typically when they felt great, and so that's where we're shooting for. That's what we're trying to get people back to. We're not trying to turn people into a Schwarzenegger or Stallone or Mr. Olympia levels of hormones. We're trying to take them back to where they were at 25 to 30 years, a normal physiologic level. The procedure itself is pretty quick. You lay on your side facing away from me. I need about a hand's width of hip exposed, a little bit of betadine to kill the bacteria on the skin, local anesthetic to numb it up, so that's going to burn before it numbs, a little incision, put the pellet in. This actually is a pellet for a lady later on today, so they're very small. It's in this little jar, it's a little tiny jar. So the pellets are, probably a Tic Tac size. They're very small. They dissolve completely in 3 months. It's not possible to remove them. So that's a downside of pellet therapy, that you can't change the dose within that 3-month time frame. So typically we want to shoot for the lower range. I would much prefer for my patients to come back to me and say, yeah, I'm a little bit better, but maybe not enough yet. I, expected a bigger bang for my buck, so to speak. I would much rather take the professional risk of somebody being underwhelmed and then increasing their dose the next time, versus overdosing somebody. I definitely do not want to overdose somebody. So we would follow the hormone profile. We'll check the hormone profile 1 month after the second insertion and see if we need to fine-tune the prescription. And then after that, we follow the hormones once a year to make sure that we're still staying within that physiologic range, that 25 to 30-year-old range that we're shooting for. After the procedure, so then just Steri-strips, there's no stitches or anything, a Band-Aid. Afterwards, you want to avoid water for 24 hours. You don't want to leave your clinic appointment and then go soak in the hot tub or go swim a bunch of laps. You can shower the next day, but you just want to be careful of that site. You don't want to go do a heavy workout afterwards. Reason being is you don't want the pellet to pop back out. You want to give the body some time to heal that track and close up to prevent the pellet from coming right back out. So you don't want to go from the clinic appointment, go straight to the gym and work out hard, do a bunch of squats, and have that pellet pop out. You also don't want to go and get a massage and have that area massaged. But by and large, people just take some Tylenol, have a little bit of soreness over the next day or so. It's typically not that big a deal. So those are the main benefits from testosterone pellets. It's possible to do an estradiol pellet. It's possible to do a progesterone pellet. But the main pellet that we implant is the testosterone. And then we have most of our clients on a progesterone capsule for other benefits. So if you have any questions, please feel free to call the clinic here. The other patient population that I forgot to mention is on our testosterone and anastrozole pellet, the other population that can really benefit from that is breast cancer patients. If the breast cancer is sensitive to estrogen and we really want to prevent that conversion and make sure that their body's not converting into the estrogen because their breast cancer is sensitive, then we'll use the testosterone and anastrozole combo for them also. Anyhow, if you have any other questions about pellet therapy, feel free to reach out to us. The number at the clinic is 480-418-3678. And I'm Dr. Harrison at Incredible Health. Thanks.